Welcome to the Lessons from Your Hairstylist podcast, where we uncover and leverage your unique beauty and personal style. I'm your host, Sarah Cruz, a beauty industry educator and hairstylist with 30 years experience. This show is dedicated to providing you with insights and practical advice for living a happier, healthier, and more fulfilled life. Experience that special stylist-client bond right here as we dive into conversations with experts in beauty and wellness. Here, you'll gain valuable tips on personal style and self-care to empower your journey. Join me to unlock the secrets to living beautifully well while elevating your lifestyle, mind, body, and spirit. Your appointment is now, so have a seat and get ready for transformation. Well, hello and welcome to the Lessons from Your Hairstylist podcast. I'm your host and hairstylist friend, Sarah Cruz. And today I am so excited to welcome on Dr. Amy Brenner. So Dr. Brenner is a board-certified gynecologic surgeon in Cincinnati who focuses on treating her patients from a holistic, natural approach. And I actually found Dr. Brenner myself when I was looking for a physician who just truly has the perspective like I do, that looking and feeling your most beautiful many times combines optimized health at any age, because as I'm getting a little bit older, I find that the healthier I am, the better I feel. But along with possible cosmetic offerings as well that can enhance and optimize kind of what we're working with on the outside. So one major reason why I started this podcast was to help clients and stylists alike to really explore and tap into ways that the salon experience could provide value beyond the services that a salon could offer, just beyond products and the services that your hairstylist could offer. So I just think it's extremely important for stylists to understand that there's opportunities to better serve their clients, and just really becoming aware of what those services and offerings might be, and really when to offer those and who to recommend. So there's a lot of times where there are certain challenges that we can't always totally overcome in the salon or totally treat. So that's one reason why I wanted to bring on Dr. Brenner, because as she looks at things from an inside and an outside perspective, and we just kind of want to look at the relationship between sort of what's going on the inside and how it affects what's going on the outside. So welcome, Dr. Brenner. Thank you so much for coming on the podcast.
Oh, thank you so much for having me, Sarah. You're absolutely right. We get a lot of referrals from the hairstylist, because obviously you're seeing your hairstylist and sitting in that chair for sometimes a couple hours, and there's a lot to talk about. So
There is. And I feel like the services that we offer can kind of go hand in hand and complement each other. I know that the last time we talked on your podcast, the Healthy Her podcast, which everybody will have to check that out. I'll make sure to put that information in the show notes. But we were just talking about how those two things kind of complement each other and how we can sort of refer each other based on our own expertise.
yeah, no kidding.
Yeah. So I want to get into just getting to know a little bit about you first. Hopefully the introduction was semi-accurate. I like to make sure I have the wording correct. So if you could just tell us a little bit about you and basically what inspired you to get into what it is that you do now.
Yeah. Well, you're absolutely right. I am originally board certified in obstetrics and gynecology, and practiced traditional OBGYN, delivering babies, doing pap smears, um, treating vaginal infections, just, what a typical OBGYN does. And I did that for 11 years in a big group here in Cincinnati. And then when I got in my early 40s, I just felt like somebody pulled the rug out from under me, literally, as I felt like I'd always been pretty healthy, of what I thought looking back was eating right, exercising. Um, but I found myself having a lot of symptoms, a lot of mood issues, where I had three, you know, littler kids at the time. I felt like when I was around my kids, I felt this like just stressed out feeling. My libido was essentially non existent. I wasn't sleeping right and just felt like I was just putting on the pounds despite what I thought was eating right and exercising. And I had heard patients come in saying they were doing these kinds of hormone treatments. And, as an OBGYN, you would think you're a hormone expert, but we're really not. We're just not trained in that area. We do a great job as OBGYNs in our training of doing surgery, delivering babies, managing vaginal infections, but managing hormones is just not something we're taught. Where traditional medicine is taught, you tell me a problem and I'm going to write you a prescription. So the tools that I had in my toolbox and what I see coming into my practice of patients who have been treated by their typical gynecologist is writing prescriptions for birth control pills, sleeping pills, and antidepressants. And that's what I was doing for myself. And it just wasn't working. And so I decided to leave that group and focus on this kind of care. And eventually ended up getting board certified in functional and anti-aging medicine. And first, I fixed myself by kind of balancing all of my hormones, if you will, and then said, I have to do this for a living. There's such a need for this, and so I started my practice. It's 14 years old now, and it just really expanded from there. We started off with hormone therapy and some aesthetic treatments, and now we have a lot of tools in our toolbox, not just hormone therapy, but a lot of anti-aging wellness therapies, whether it's IV therapy, ozone, NAD, gut health, and optimizing all of the hormones. And it's been really exciting. And we've been able to offer a lot of life-changing therapies for our patients to, as you said, to make people first feel good on the inside, and then people want to start looking good on the outside.
Yeah, absolutely. And I can really relate to what you're saying. I think a lot of times we start from a place of needing certain treatments ourselves, realizing the impact that it makes on our own lives, and then thinking, "Oh my God, I got to figure out a way to help other people with this because it makes such a difference." And one of the things that I noticed, about your practice was that it just ran the gambit of all of the things that you can really access in order to enhance the way that you look and the way that you feel. And it just, there's so much that it's like kind of crazy, overwhelming. But one of the things that I think, I see a lot of times in the salon is probably a direct correlation to a lot of the things that are going on inside. Many times it could be genetic, I guess, but hair loss is something that a lot of women deal with. There's a lot of different types of hair loss. There we can give treatments, we can do the trims, we can, help them in their hair care and learning how to deal with what they have. We can do extensions. There's a lot of different things, but there are certain there's a lot that we're limited by and we can't address. So, I probably am in this point right now of thinking about it this way because as I'm 53, yesterday was my birthday.
Happy birthday.
Thank you. I'm understanding that, hormones play a huge role. Can you talk about what hormones play as far as a role in hair loss and like what some of the other factors could be in what clients are seeing in their hair, especially as they age, maybe through pregnancy and then also as they age.
Yeah. So hopefully you're okay that this podcast is about 3 or 4 hours of happening. all the causes of hair loss. But I will say hair loss is probably one of the most difficult things that we address in our practice. Is It's difficult, and I get it from a standpoint of patients they come in and they want to know the root cause of why is this happening to me. And you mentioned there's a lot of different causes of hair loss. If it's okay with you, so we don't make it an 8-hour podcast, the most common cause of hair loss is androgenic alopecia, which makes it sound like it's testosterone related, but it's really age related hair loss. And that's the most common one. I'll touch on what you mentioned of pregnancy hair loss. And that would gonna go in the category of telogen effluvium. What that means is a certain type of stress. So pregnancy is a huge stress on your body. Um, Surgery can be a big stress, a car accident, a major life event. And that'll cause a temporary hair loss of shedding or maybe a significant illness where you will have that stress in your body and then months later notice significant shedding. And then eventually, like the pregnancy hair loss or telogen effluvium, is it'll stop and that hair will come back. Um, Age-related loss of hair loss is, which is what's really a lot more common that we see kind of age 40 on up. And the older you get, the more common it is. And it's really common. 80% of men experience this, 50% of women experience this by age 70. And it's really age related, but we can get into kind of the causes of
Yeah.
hair loss.
You treat men and women at your practice as well, which I see probably more women with this going on. I've noticed that a lot of my clients who I've had in my chair for 10, 15 years, I've started to notice that their hair is changing. The texture is different. It doesn't grow as long, it's thinner. And do you know why these changes happen as far as like the age related thing and what offerings, you might have for that specific type of hair loss that goes beyond what we could do in the salon?
Yeah. And I love the podcast that we did of things you can do from your standpoint to take care of the hair that you have. I thought those were some great tips. But as far as workup for hair loss, we can do a limited evaluation of the most common things that we see causing hair loss, which is iron deficiency. That is very common in women. That's usually related to heavy bleeding or pregnancy, and then heavy bleeding associated with periods. And severe iron deficiency can be a cause of hair loss. Thyroid issues can be a cause of hair loss. Uh, Testosterone issues but that's kind of a fine balance of if somebody has um, high testosterone because of polycystic ovary syndrome, they can have unwanted hair on the head, but also a lot of unwanted hair in places you don't want hair. Um, on the flip side, giving testosterone to women, which has a lot of health benefits and makes people feel better, more energy, better sleep, help you with hot flashes, libido. I don't typically see that it causes hair loss, except in a very, very small percentage of patients that has a genetic predisposition. Um, but otherwise, testosterone I see the side effect I see is causing unwanted hair growth. But other tests we can do as far as the workup is actually doing a gut test. We call it the GI map of really looking at the gut microbiome. And surprisingly, there's a better yield on healing the gut and the gut microbiome than the other hormone test, I should say. But adrenal issues that can be contributing. But as far as treating the underlying problem, looking at gut health is where we see the biggest yield coming from as far as treating hair loss from a medical standpoint.
That is so interesting because I feel that for the most part, I've at least heard about most of the different contributors to hair loss, but treating the gut microbiome is something that I've just never heard. So I'm sure that many other people didn't even know that that was actually a thing. Can you just go a little bit deeper on that? Or how could somebody maybe identify if that would be something, or would they have to come in and get tested or?
Yeah, we have tests in our office. It's not a test that's covered by insurance, but it's a kit that you go home and you actually send some of your stool into the lab and the specialty lab. And it takes about a month for us to get that test back, but we get pages of information about somebody's microbiome, if they're properly digesting the food, if they have inflammation in the gut from a parasite or yeast overgrowth or organisms that are not supposed to be in there. And in an ideal world, it would be great if everybody could do that test. And I know a lot of true functional medicine practices, they have everybody do that. It's non-negotiable. So
I mean, I want to do that now. Like, I mean, you're saying that. I'm like, oh, I want to know about
yeah,
that.
I mean, honestly, this has nothing to do with hair loss, but I do that test as a kind of anti-cancer regimen because 80% of your immune system is in your gut. So having a healthy gut can lead to a healthy immune system. For me, fixing my gut and fixing one bacteria that I was missing called Akkermansia helped with my blood sugar control. So, you know, we recommend doing that test for a lot of different reasons, not just hair loss.
Wow, I feel like we could just go off on like a whole podcast about just that. That is so
Yes.
that's so interesting. I'm like, I had no idea. So that, I mean, and that'll be hugely helpful as well. And again, just another factor that the hairstylist wouldn't be able to really give that. The average hairstylist wouldn't know to even have a client look into that type of a thing.
Well, the average gynecologist wouldn't recommend that either. So,
Yeah, yeah.
or family physician. So, some of these tests that we do are covered by insurance from your regular lab, path group, LabCorp, Quest, that type of thing. And some of the tests, like the gut test or the adrenal cortisol test, those are more specialty labs that a functional medicine physician can order that aren't typically covered by insurance. So,
Got it. I think that that relationship between a client and a stylist is so much more strengthened the more information that the client or that the stylist can provide the client, and the more professional recommendations that they can make. And I think that many times they come for probably like with your practice, they need therapy too at the at the same time, or they just want to talk about things that are going on with them, maybe even if they're not hair related. So health is also one of the lines of defense, I guess, that the stylist can be a part of for the client, because I feel like in our profession, we're naturally looking for things that enhance our beauty and our health and things like that. So that is something I didn't even expect. Just a little hidden gem here on the podcast, but that is so interesting too. So that's something that's so good to know. I know in your practice as well, you have supplements, like a whole line of supplements in your practice as well. And you hear a lot of times people talking about taking biotin for health, for hair health, for hair, skin, nails. What are your thoughts of the effectiveness of biotin? Is it something you offer in your practice, or what do you think?
Yeah, I wish I think there is some data when you look in the medical literature that if somebody has a true biotin deficiency, that biotin can help. My clinical real world experience is that it's not that simple of just getting a biotin sample or supplement and that's going to fix the problem. Or if, because I think everybody knows about that. I'd say most women have heard about biotin and
Right.
improved skin, hair, and nails. And I would say real world experience is I haven't seen it really move the needle that much. And I do think it is important to take a hair supplement for the nutrients that your scalp needs to have a healthy hair follicle. I think that helps with the texture of the hair and maybe stops the shedding. But, even with the pharmaceutical grade hair supplements that we have that you can only get at a physician office, I haven't seen it really for people that come in and have significant hair loss that you could see with the naked eye. I haven't seen the supplement alone cause, oh, I'm all good now. I think it needs to be a multimodal approach. But I think those hair supplements are good for somebody that's starting to just notice texture changes or they have a little bit of mild shedding. But for somebody that already has significant hair loss, I think it needs more attention.
Yeah. That's good to know. I was thinking I was on the same page with that, wanting to make sure I was giving the right information on that. I agree. I would always say I feel like unless you just really have a biotin deficiency and that's what's causing the hair loss, it may not be. But I like how you added on to it and talked about the fact that taking a hair supplement is actually a good thing and can be helpful so long as it's not, something that's caused by, something deeper that needs to be treated in a more like medical way. If a patient came to you for help with hair loss, hair thinning, excessive hair shedding, where would you start to create some sort of treatment plan for them?
Um, you know, I think it really depends on the patient. Some people want to really dive deep into what are all the causes. And if money was no object, I would have them look at, all their hormones. So the sex steroids, make sure those aren't too high, their thyroid, their iron, their vitamin D. Look at their adrenals with a cortisol test, have them do the stool test and we will absolutely find abnormalities when we start doing all of those tests on people. Um, I would say the biggest yield on all of those is actually the gut health. Um, but if I really want my hair back and I want it back yesterday,
Mhm.
then our most successful treatments of actually growing the hair back as quick as possible is to specifically treat the scalp. Um, and our favorite treatment is actually infusing kind of fertilizer for those hair follicles on the scalp with growth factors or what's called exosomes. And we've seen amazing results with that treatment. Now, the downsides of that treatment is it's not a comfortable treatment and it's not covered by insurance. There are some other topical medications like using topical minoxidil or some oral medications, but there are pluses and minuses with those treatments as well.
The treatment that you were just talking about with the growth factor, would that be specifically for someone with the androgenic alopecia type or okay, and then that actually you've been able to see regrowth of hair with that treatment. Is that like the
Yes.
PRP treatments or
Yeah, we used to use PRP and take the growth factors from somebody's own blood and process it. But now we get it from, we actually purchase the growth factors, which are from a placental derived exosome. And there's just a lot higher concentration of growth factors compared to getting it from your own PRP. Now, if somebody really wants PRP, we can do that, but we found that we get a lot better results of using the growth factors that we purchase, and
Okay.
it saves a blood draw.
Wow. Okay. Oh, yeah. So things just continue to get more and more advanced all the time, which is exciting. Well, and speaking of that, can you think of like any new exciting advancements or technology that has just recently come on the market that maybe people don't know about that you're
Yeah, I mean, I think in an ideal world, if somebody did the medical workup and then they don't want to wait 6 months, because the sooner you attack this problem, the better. Also, kind of the more you throw at it, the better. So, looking at the medical cause, putting the fertilizer on the scalp with the ERPRP or exosomes, taking a hair supplement. Um, Using a laser cap with low level light therapy. Um, I think that kind of gets the gets the best result if people are willing to do all of those things. Using a hair serum that comes with the supplement that we use, and then we get really good results. I think coming down the pipeline, I think there are some lasers that could treat hair loss. um the downside of that is, the cost. Some of these things are a lot less expensive, some could be more expensive. um Hair transplant is certainly an option, and but there's some obviously downtime and
Yeah.
costs associated with that as well. We don't do hair transplants.
right? You know, going back to the growth factor treatment, I know you said it was definitely not comfortable, but could you talk about a little bit sort of exactly what it's like to be a patient and get that treatment, sort of what the process is?
Sure. So, what we do is we take the growth factors and we microneedle it into the skin, which is this device that has these tiny little needles in it, and it drives the product into the hair follicle or into the scalp. So, just the scalp in general is just very tender.
Yeah.
Um, and it's just not a comfortable treatment. So, um, we could put numbing cream on the area. It helps a little bit, but we usually give nitrous oxide gas to inhale during that process, and also could use a cooler to use for that. Um, but it's a little pinchy.
Yeah. Well, the gas does help with
Yes, the gas does help.
tremendously as but on the other point of that, what if somebody was interested in that, what do you have like a range of cost, just a ballpark that they could be thinking about if they were interested?
Yeah, depending on where you are or what part of the country you're in, I would say a typical cost per treatment is anywhere from 600 to 1,000, maybe $1,200. We're in the lower end of that range here in Cincinnati. But we usually do it in a series of several every 2 to 4 weeks.
Gotcha.
It's
Okay.
not just one and done.
Right. And I know too that you had talked about the laser caps. How effective do you feel that those are? And what would be the cost bulk?
Yeah, I mean, the good thing about the laser caps is once you buy them, you have them forever. So, I don't have an issue with hair loss, but I actually use a laser cap and, wear it. I try to wear it a couple times a week, and it's for just 6 minutes, and I'll put it on while I'm putting my makeup on or something like that, because I know that hair loss is so common. So, trying to take some supplements for prevention and using the laser cap. And um, I try to have my husband use it as well. So, it can be used by everybody in the family, because once you have it forever. And using the laser caps are one of the few things that's actually FDA approved for the treatment of hair loss. But you have to use it consistently.
Right. How long does it take to see the effects of the laser cap?
Yeah, I think all of these treatments, no matter what you choose, take anywhere from 3 to 6 months before you're starting to notice a difference. So that's the downside of just doing one thing and waiting and seeing, because whatever you choose, you have to wait 3 to 6 months before you're just starting to see the results.
Yeah. Yeah, that's true. Nothing is ever instantaneous, is it? I mean, we
No.
gotta wait for everything in this life. Um, well, that's all been such great information. What other wellness type of approaches do you take there? And what are maybe some of your most popular treatments there, even aside from hair?
Yeah, I would say, I mean, people enter our practice all sorts of ways. We have a lot of different services, which is good, but then sometimes people can be overwhelmed of where do I start. Um,
I don't know
I
how
think,
you're not overwhelmed with everything. You've got so much.
yeah. Well, I will say, like, I am probably our patient, our practice's best client, because I really practice what I preach. But I would say most patients are coming into our practice because of hormones. That 40 to 60-year-old, whether it's perimenopause, where they're just starting to have symptoms of hot flashes, night sweats, low libido, not sleeping as well, mood issues, brain fog, um, maybe some aches and pains. And then when somebody's in menopause, you can take all of that and then kind of those symptoms worsen, and more hot flashes, night sweats, more vaginal dryness, maybe some pain with sex. So those are can't lose weight, tired all the time. So those are the most common symptoms that people are presenting to our practice for. And we do a full panel of hormones, of looking at the sex steroids, a full thyroid evaluation, looking at the adrenal or stress hormones, making sure their blood sugar or insulin is in the right range. Um, and that helps with a lot of things.
Mhm.
Um, Certainly, I know people can get on Dr. Google and say menopause is a big cause of hair loss. And unfortunately, um, taking hormone or replacement therapy, I haven't seen like, oh, my hair's all back. Because, again, as I stated earlier, the biggest cause of hair loss, I think, is just age, and that hair follicle itself just being aged and needs some nutrients. So that's why I think the microneedling and increasing blood flow really makes a big difference in treatment.
What about DHT? Something that we hear about. How is that affected by hormones, or why is it that some people produce? Can you tell us what it is first of all, and then why some people are more affected by it than others?
Yeah. So DHT stands for dihydrotestosterone, and it's testosterone getting converted to dihydrotestosterone, and it's dihydrotestosterone that can affect the hair follicles. So that's why medications that block dihydrotestosterone at the hair follicles, such as a drug like finasteride, can potentially help with hair loss. And it's an oral medication. Now, it has some potential side effects of um, causing post finasteride syndrome and leading to sexual dysfunction in men and women that could be permanent, even with just a few doses. So, and it can lead to mood issues, and certainly can't be given to anybody that wants to become pregnant in the future. Um, but people have a small percentage of people could have a genetic predisposition to being really sensitive to DHT. I think checking DHT levels hasn't really correlated and what the appropriate levels are. So that's not something that I check in my practice, because I don't think there's any one level where it really matters. It's more of a genetic predisposition of who's more sensitive to DHT than others.
Hmm. It is surely a complex issue for sure. And I know that there's just everybody is such an individual. I feel like that's what it always comes down to, right? Is like each one of us is so different and what we're working with is so different. So I would imagine that in your practice, you really have to spend a lot of time on, testing people and individuals and really customizing a treatment plan for whatever it is that they're
Yeah.
doing.
Yeah, it really is it's individualized because some people are just like, look, I want my hair fixed. And so that's where I think specifically treating the scalp gets us there the quickest. And other people want to do all the medical testing to see if they can come up with a root cause. If
Mhm.
money was no object, it would be great if everybody could do both. But I haven't met a lot of those patients.
Right. Yeah. Well, and on that note, I have to ask you this now since you had talked about Google, because I think it's so funny. It's one of those sort of like cliches of like the patient comes in and they've been Googling. So tell me, how do you truly feel about the patient Googling and bringing you information from the internet?
I would say in general, it's good because telling somebody that we're going to have you collect a stool sample to fix their hair loss, if somebody hasn't read that another place and this is the first time somebody's hearing it, they're like, oh my gosh, I've never even heard about that. I need to go home and do my research. So I would say in general I like it. And but on the flip side, there's a lot of misinformation out there that, it's just like, if somebody Googles biotin can help with hair loss, like it's just not that simple.
Mhm.
um, but I would say in general, I'm a fan of people doing their research.
Are there some good sources that people could trust to go to as far as if they're looking for information about their health or if they're interested in a specific treatment that you might have to offer
Oh my
before they come
gosh.
in?
Yeah, I think that's what's tricky is, I saw a patient today about hormone replacement therapy, and she really wants to do her own homework. So, I have a lot of resources in my office of specific books to read from a patient standpoint. But I think that's probably the challenging part. As physicians, I'm looking more at looking on PubMed and looking for journal articles to get my data from. But I think that's, I feel bad for patients because at the end of the day, I think you need to find a doctor or a provider that you really trust, because trying to figure this out on your own is, you can maybe have some what questions to ask and do a little preliminary research. But as far as patients figuring it out themselves, I think you need to find a provider that you trust and go with their recommendations, because otherwise I think, you know you would need to go to school to figure this kind of thing out.
Right, exactly. And we run across that as well in the salon, people are TikToking it. They're on TikTok, they're looking at the stuff that's coming out and they're just like, "Oh, I saw this." And so there is a lot of misinformation out there. There's good information and sometimes it's hard to
Yes.
untangle
I
it.
mean, why can't I make my hair look like it does when I leave the hairstylist? Like, I watch what she's doing. I'm like, but why can't I make my hair look like that?
I think we talked about that on the last episode and you're like, "I want to know why I can't."
Why can't I do it? I watch you every time. Like, it just never turns out. I buy my curling iron from your salon. I'm using what you use.
Yeah.
And at the end of the day, you're the professional.
Yeah.
So,
Well, and I think that's a really good note to kind of end on because we're both professionals in different areas with different angles and different knowledge and expertise. So that's why I just feel like it's such a good thing to be able to have people that are good, reliable resources to refer our clients to, and maybe vice versa, because we can't obviously even address the tip of the iceberg on a lot of stuff. But we are people that a lot of people come to as a resource because they see us every 6 weeks and you talk for an hour and a half or 2 hours, and so if you have good information and things to turn them on to, that really strengthens the relationship of the client hairstylist. So this is, I think, a great episode to really illustrate that. I really appreciate you coming on. Can you tell us, is there anything else that you would say, just like looking at everything we've talked about, is there anything that you'd want to add?
Yeah. I just think that people need to, I like a Google, and I think knowing of what treatments are out there, and if you're going to a doctor with these lists of complaints, is you don't need to just accept it that you're getting older, this is how it is, and you just need to accept it, because there are so many tools out there these days, not just for hair loss, but for so many other complaints. So just don't give up, and you don't have to accept just getting old comes with these host of issues.
I'm so glad you said that. That's very encouraging to hear, especially after the latest birthday. It's like you keep you try to hold on, but it gets harder and harder. So, I'm excited that there's just more and more coming out to not only make us feel good and feel better on the inside, but shoot, it feels good to look good on the outside too.
Yes,
So,
it does.
yeah, exactly. Well, thank you so much for coming on. Can you tell us where people can find you if they wanted to come and visit you in the office, where they can find you online, and about
Yeah.
your podcast?
Yeah. We have a lot of resources on our website, which is dramybrenner.com. Certainly, we can be found on all the social channels at Amy Brenner, MD and Associates on Facebook and Instagram. And you mentioned our podcast, which is called Healthy with a I, Healthy Her.
Perfect. Well, thank you again so much for making the time to come on. I hope you have an amazing day, and I'm excited to get this episode out for people. I think they're really going to enjoy it. Thank
Sure. Thanks for
you.
having me, Sarah.
Thank you for joining me on this episode of Lessons from Your Hairstylist. I hope you found inspiration and actionable insights to embrace your unique beauty and elevate your life. Remember, it's all about taking small steps towards a happier, healthier you. If you enjoyed today's conversation, please take a moment to subscribe, leave a review, and share this episode with someone who might benefit from it. Together, let's continue unlocking the secrets to living beautifully fulfilled. Until our next appointment, keep your thoughts on your visions, your self-talk kind, and remember to keep your heart open so you don't miss any opportunities waiting for you out there. I'll see you on the next one.